Welcome to the Listen Up podcast, where we explore hearing loss, communication, connections, and health.
Hi, everybody. Dr. Mark Sims here. I'm the host of the Listen Up podcast, where I feature leaders in healthcare. This episode is brought to you by the Listen Up Hearing Center. I help patients to effectively treat their hearing loss so that they can connect better with their families and friends and remain independent. The reason I am so passionate about hearing loss is because I lost my brother Robbie twice. First from his hearing loss from the radiation, from his brain tumor, and again when he passed away. I only care for ears. I'm the E of ENT, who's performed over 10,000 surgeries and taken care of many more with nerve hearing loss over the past 20 years. I'm the founder of Listen Up Hearing Center. I'm also the author of a book of the same name, Listen Up, A Physician's Guide to Effectively Treating Your Hearing Loss. If you want to learn more about that, go to listenuphearing.com. I have a great guest today. I'm really excited. It's Dr. Jane Madell, and she's got all sorts of hats. She's a certified audiologist, a speech language pathologist, a listening and spoken language specialist, and an auditory verbal therapist, and has been in pediatric audiology for 50 years. She's got a lot of great experience she's going to share with us. She's currently the Director of Pediatric Audiology Consultants. She does some other stuff we're going to talk about too, including posting a blog. She was formerly the Director of the Hearing and Learning Center and co-director of the Cochlear Implant Center at the Ear Institute, Beth Israel Medical Center, New York Eye and Ear Infirmary. We are really excited to have her as a guest today. This is exciting. Thank you so much for sharing your time, and welcome.
Thank you. I'm excited to be here.
Thanks so much. So tell me, how'd you get here, right? In other words, what was your pathway to this? I mean, I know you're very passionate and prominent in the field. How did you get into this area?
Well, when I was in high school, I was trying to decide what I was going to do when I grew up. And I had a cousin with a hearing loss. And his father, my uncle, said, "Why don't you come with us?" At the time, there were no services in schools for children with hearing loss. If you had a hearing loss, you had to get your services outside of school, which is why so many kids ended up in schools for the deaf, because the families weren't able to manage to get all the services kids needed. Well, the New York League for the Hard of Hearing had a program on Saturday morning where kids with hearing loss came in and they got tutoring and they got speech therapy and they learned to listen in noise, and they did a lot of practice things, and they divided by classrooms by age.
That's great.
And my uncle said, "Come and see what's going on." And I went and I said, "Oh, this is good. I'll do this." And so I started looking, and I went to the Bronx High School of Science, and my college advisor, I already had some science stuff because I'd gone to a high school that did that. And then my college advisor said, "Well, Emerson College is a place that does a lot of what you're interested in." So I went to Emerson College and I got a bachelor's degree in speech and hearing. And David Luderman was there. And David Luderman, for those of you, the listeners who don't know him, started a deaf nursery program. And he has spent his career as an audiologist, but he has spent his career counseling families and providing families with emotional support. And David was my mentor, and I learned an incredible amount from him. And then I went on to graduate school, and here I am.
That's great. And so tell me, you've got a broad range of experiences. You've gone through a lot of fields, obviously speech language pathology and audiology, listening, spoken language, auditory verbal therapy. I mean, these are all the major credentials in that space. So what do you do now? Like, in other words, I know you're in the
I've retired from. I was a clinical director for almost all of my career. I was the director of at the New York League for the Hard of Hearing, and then at Long Island College Hospital, then Beth Israel, then New York Eye and Ear. And when I retired from being a clinical director, I still had millions of families who wanted to consult with me, and I had, well, millions is probably an exaggeration, but I had a lot of
thousands.
Yes, right. Who wanted to consult with me from all over the world, and also people who wanted me to lecture. So I have been doing that. I've been traveling around until COVID. I traveled the world doing things. I was in Mongolia and China and Vietnam and, less obscure places, and all over the United States, lecturing about hearing. I mean, what I believe is that if children are given the right assistance, they are capable of being whoever they want to be. And so my goal has been to help families do that and to help kids do that. And I love the kid, listening to the grownups I've been in this field for more than 50 years. And so I've known kids for a long time. And it's, so I feel very attached to all of these kids.
Which is wonderful.
And so I know what happens, and I've seen what's happened over time, how children changed as the technology changed. When I started in this field, we had analog hearing aids that weren't very loud and that had a very narrow frequency bandwidth. And I watched what happened as the bandwidth expanded, and then we went to digital, and we had much better hearing aids. And then we developed cochlear implants, and we saw what that did for the kids with severe and profound hearing loss. And so it's a different world. The technology and also the newborn hearing screening, which identifies these babies at birth, has given everybody a better chance.
So for the listeners, what Dr. Madell is talking about is each one of these technologies for the right patient gave them more access to sound to make them to be able to function better because they had more information to be able to learn language or communicate. Do you have any, interesting, just popped in my head, any multi-generational patients, like where you took care of the parents and then you're taking care of the kids of the parents? Because it would think
yes.
Well, but with some of the genetic hearing loss, fortunately or unfortunately, unfortunate that they have the hearing loss, but fortunately that they found a great resource in you. So there's some...
and also they expected that they might have a child with a hearing loss.
Right.
And so I saw the babies days old, like often on the way home from the hospital. Wow. So I saw the babies, and what they have said, what those families have said is they couldn't get over how much easier it was for the second generation.
Yes, I think
because the technology was better. They got technology on them within weeks, and they knew exactly what to do.
The system's better. Wouldn't that be a right way to say it? I mean, the system is much better.
The system is better, but I think for these families, it was that they didn't have a learning curve to go through.
They knew what to expect, right?
They knew what to expect. They still had to go through all of the emotional stages of grief and learning to live with it. But they knew what to do. And so they knew they needed therapy. They knew who to go to. They knew they didn't have a learning curve. They had it right away.
I'd agree. I mean, I have patients where it's genetic and the families have had multiple children. And so certainly the process they go in the first is different than the process the second, because everybody knows, the parents know the drill, they know what they need to do. And although they're emotionally impacted, they're a little more accepting because they've been through it once before and they knew expectantly.
And they know that it will work. They know that their children will succeed. They don't, most people, when parents have a newborn child and they're given a diagnosis, the child fails newborn screening, and then they come to an audiologist and the child has a hearing loss. That, first of all, it's a shock to them.
Yeah.
They don't they had no reason to believe their child was going to have a hearing loss, because 98% of children are born to parents with normal hearing who don't have hearing loss in the family that they know of. And if they ever met a person with a hearing loss, it was a grandfather who wore hearing aids that he hated.
Right.
So they don't have the optimism that a parent has when they have a successful child.
With great
They
outcomes.
know they're going to have to do a lot of work for the next child, but they know it's going to be all right.
So, when you meet these parents, let's say somebody who doesn't have the benefit, if that is, of having a previous child or something, like what are the take-home messages you give maybe at the first meeting? I mean, and I know one of the hard parts becomes, honestly, they might not process it all, because once they hear your child has a hearing loss, Sometimes, I mean, people will describe this as other things. Like when people are told they have cancer, they don't hear anything else. And so once people hear that, sometimes they turn off. So
Right.
not on purpose, just as an emotional response. So what are the things you want them, like if you were to say, these are the top things somebody should take away, what are those things you try to do?
This child can still be anything he wants to be.
That's wonderful.
That's the most important thing I tell them. We will help you get through it. I don't give them a lot of information at the first time unless they ask me.
Sure.
I say, this is the hearing loss and this is what it means. So and this is what this child can hear and this is what this child doesn't hear. So this is what we're going to do to fix it.
Yeah, sure. That's great. I mean, just giving them the kind of, and as you say that as a parent, right, and as a clinician, that's what every parent should think of every child, right? And what every clinician should think of every child and what educators should think of every child. So it's wonderfully simple, but also something we need to be reminded of.
That's right. And we need to say it to parents. And when someone says to me, I thought my child was perfect, I say, your child is perfect.
Right. That's correct.
You have a perfect child. This child just happens to have a hearing loss. I have a hearing loss. I have eyeglasses. That doesn't, I don't want to say I'm perfect because I'm obviously not, but the point is everybody has something and your child is still perfect.
Yeah, that's wonderful. All right. So I think that's a great takeaway that you just want to get to that. So, all right. So then they come back for the second. So what are kind of the bigger overarching things you try to touch on for these?
Well, if the family can handle it, on day one, I take ear mold impression.
Right.
Because we want to get I say to them, we want, hearing is about the brain.
Access to sound is important. As soon as
we want to develop his brain. And we know that it goes from the ears into the brain. We need to put technology on him so he will be able to hear. And that's all we're trying to do day one.
Sure.
And 99.9% of parents will take ear mold impressions on day one. Sure. There are some parents who just aren't ready. And then I make an appointment for them to come back in a week, just so I can keep a handle. I can talk them through it and see how long it takes. And I mean, I had a family who came back, I think for 4 or 5 weeks, and I was beginning to panic because I was thinking about all the lost time this child had. But, she came back every week. Mom came back every week. And, there's an advantage to being in a pediatric clinic where all the services are available.
Right.
And that is that they get to see all these kids who are walking around with cochlear implants and hearing aids and talking and laughing and making jokes. And they see all these other kids and they say, okay, maybe this isn't so bad. So day one, we take ear mold impressions. We have them come back in 10 days and we fit the child with a hearing aid. And the child goes home with a hearing aid. Right. And so, and then what we say to the families is talk. The more you talk, the more he hears. And we arrange for them to start therapy right away. And then, they see what happens. And then we continue to monitor the technology and make sure that technology is doing what it needs to do.
So if people are going to, go ahead.
Which means that the child needs to hear at the top of the speech banana in the speech string bean. And we show them all of that. And my audiogram has the speech banana on it because I want them to understand if you're not at the top of the speech banana, these are all the phonemes you're not hearing. And that's why we're moving to a different hearing aid or to a different setting or to cochlear implants.
Right.
And, I made a documentary a few years ago called The Listening Project. I did it with a mom who's a filmmaker.
Wow, that's great.
Irene Taylor Brodsky. She's the mom of a child with a hearing loss and also the daughter of people who are deaf. And interestingly enough, it's a different gene that her son has than the parents have. So
it's not the same. It's different.
It's not the same gene. Oh, it's just coincidentally. And they came to me. They live in Seattle, but they came to me to discuss whether this child should have a cochlear implant. And I said yes, and he got a cochlear implant, and he's magnificent. I mean, he's just terrific. He plays the piano. He's in high school, and he's Nobody
Being a
would
great
know.
young teenager from your description.
Typical young teenagers, terrific. Um, and so what we did was we interviewed 15 kids whose hearing loss I identified when they were babies, who are now young adults. Now, these kids were identified. They were born before newborn hearing screening. They were born when some of them had analog hearing aids to start with.
So how old were they at the time of the film?
In their 20s and 30s.
Okay.
And that was, I made the film 4 or 5 years ago.
Okay.
It's called The Listening Project, and you can find it on the Hearing First website, hearingfirst.org. And I interviewed these 15 kids. And the reason I made this documentary was because I wanted families of newly identified children to see what's possible. Because the problem with our kids being so successful is that they melt in to everybody around them, and we don't recognize how important the hearing loss was in their lives. And you don't know they're hearing impaired because they're doing fine. They go to college, they do,
great story for you.
They're doctors, lawyers, and a rabbi, and, all these people who are typical children.
Yesterday I was doing surgery, and I was doing a different ear surgery, and the nurse said, do you do a lot of cochlear implants? I said, yeah, I do a significant amount. And I said, well, why do you ask? And she goes, because I have one. And so up until then, I didn't even know that the nurse, and that tells you, it wasn't like I thought, and I mean, I talk to people who are hearing impaired all day, right? And I didn't pick up at all, which means she was wonderfully rehabilitated. She was doing what she enjoyed. She said she loved nursing. So it is wonderful. I mean, that they do become invisible, meaning that particular thing that they have, meaning hearing loss without rehabilitation, does not become their limitation. They're just like every other person.
Exactly. And the problem is there isn't enough. I mean, if you go to the internet and you look up hearing loss, you get a lot of stuff about sign language. You don't get enough stuff about children who use listening and spoken language as the way they live their lives.
So how do you talk to these families about their educational setting?
Okay, so my view about this changed years ago. I used to, when you go to graduate school in speech and hearing, they tell you you're supposed to offer all the options as if they're equal. And I did try to do that in the beginning, although I never believed that they were equal. I always believed that there was a difference. But I offered all the language, but I said, said, if you want listening and spoken language, I can help you. If you're not choosing that, I'm not the right person, but I'll get you to someone who can. But then many years ago, I'm going to say 15 years ago, maybe, I'm not good at time. Somebody brought a family came to see me who had a 17-year-old who had grown up in sign language programs. She had not worn a hearing aid since she was 2. Because she didn't hear with a hearing aid. They didn't want a cochlear implant. She was in schools for the deaf. She had good signing skills, and she had developed retinitis pigmentosa, which is a disorder in which she was going to go blind, and she was losing her vision very, very quickly. And they wanted to know if she was a candidate for a cochlear implant.
Was that Usher syndrome, maybe?
Yes.
Okay. Yep.
And it's Usher's. And I said she could have a cochlear implant and it would help her have awareness of sound around her, but she would not develop listening and spoken language. She would not be able to use sound to hear because she had not developed her auditory brain.
Right, yeah.
And that was very traumatic for them and for me.
That's a hard conversation that I've had many times where, people want to, download the app, if you will.
Exactly. That's a good way to describe it. And so, and after that, I changed the way I talk to families. I stopped saying that they were equal. And we know they're not, because the reading skills of children who are in signing programs, the average reading skill for children in signing programs when they graduate from high school is 4th grade. That is essentially illiterate in this country. We no longer have all of those jobs that you can do if you don't speak English or your native or whatever country you're in, if you don't speak the language around you, because they're just not available anymore. Those jobs are gone. We deaf people used to go into printing. That's all done digitally now. There's very little manual labor kinds of things where you don't have to communicate.
Yeah, culinary arts is one that seems very popular, but even that, when you're on a line cooking with other, line chefs or line cooks, there is a whole coordination of the thing, unless you're going to just create, like if you're the salad chef and that's what you do. But if you're coordinating, plating a dish, there's communication.
Right. Everything you do, there's communication. And there was an article in the Wall Street Journal a number of years ago about people's who were living in the United States and didn't speak English, who spoke some mostly Spanish, but some other language, and what their annual income could be compared to someone in the same jobs who spoke English. And the difference was dramatic because they couldn't communicate and people weren't that willing to deal with them. Many years ago, I was at an early, maybe not many, but some years ago, I was at an early intervention conference.
Yeah.
And there was a mother, Carol Flexer, who's just a wonderful, who's did a lot of work talking about listening and the brain. And Carol was giving a talk, and since she and I write books together, I was sitting with her afterwards, and people were all arguing with her about sign language versus spoken language. And we were trying to give the data, and this mother said to me, "My child is brilliant, and he went into National Technical Institute for the Deaf, and he's got a degree in engineering, and no one will hire him because he can't speak." And that, it was just, I felt terrible for the mother and for the kid, but it wasn't, that was the choice they made. And I don't think they were well informed when they made the choice. Because if someone hires someone who's an engineer, then whatever the job is, if you hire the American with Disabilities Act will tell you that you have to have an interpreter available for the person. Yes, you should do that. In an ideal world, that should be what happens, but it's not something that we know people don't choose to do that.
Right. Well, yeah. I think it's a little tougher, but economics don't lie, right? And so these companies are doing what maximizes their profit, and so it's hard. I don't disagree with you. I don't have a right answer. That's a very.
I don't know. I think that the world should allow interpreters whenever they're needed. We should have a system that does that, but we don't.
Right.
We do have things that are better now. For if a person with hearing loss is having trouble communicating, we have that you can go into a system that'll give you captions. So you can have. A person who's listening to this app, to this discussion, if they wanted, they could caption what we were talking about, and they could follow it.
That's correct.
If you can read, you can get away with a lot. If your reading skills are not terrific, the federal government does provide interpreters for people who need them because they are following the rules, but not many companies don't necessarily want to do that.
Well, I think the other thing is not to say it's right or wrong, but there are exceptions to the rules based on smaller companies. And so, and that has to do with the amount of resources smaller companies have compared to bigger companies. So I don't know what the employee threshold is, but it is of a certain size So one of the other questions I asked, so you're seeing people from all over the place, it sounds like. And so how do you counsel people who say to you, I want my kid to use listening and spoken language, and I don't have an educational organization that is accessible to me, so more rural and things like that. So,
I'll tell you, one of the exciting things that happened during COVID is we learned how to provide telemedicine services.
Yeah, I'd agree.
One of my doctors said to me while I was having a telemedicine visit with her that this is going to change medicine because we're going to be able to do a lot of things remotely. And there are a lot of people now who are doing auditory verbal therapy remotely.
Yeah.
So if you have a computer and if you have internet access,
you find it.
You can get services.
Yeah, that's a great point. I hadn't really thought about that, but that's wonderful because in Phoenix, there's one school kind of dedicated to listening and spoken language, and some of the people had commutes or they would move to Phoenix to get those services, but that's probably not as needed.
Right. I think that's correct. That's exactly correct.
Yeah, that's great.
But
And
but
so,
I mean, and there are even with some of the new hearing aids, they can be programmed remotely.
correct. Yes.
I
Yeah.
mean,
I mean,
so
the hard part is some of the verification can't be performed, but that's a bigger.
that's right. But and that's only, I mean, I wouldn't do that for a child.
Right.
For a
It's a
child,
hearing
I
thing.
want them to come into the clinic because I want them to hear.
And
And
to
so
see how they're doing too.
I need to make sure that they're hearing in the string bean, which is at the top of the banana, and I need to make sure and I need to see what's happening to them with their language.
Sure, sure. No,
And
yeah. So when we were doing the warm up, you were talking. You write a blog, right? And you just
I
mentioned
do.
your book. So tell me about your blog. What do you?
And actually, the blog it was for the blog that I got started with the documentary because I had run out of things to talk about, and I decided I would interview some of my old kids. And then I met Irene at a conference, and I said, "Wait a minute, a much better way to do this is to make a documentary."
Yeah.
So I did that. But I write a blog. The Hearing Health Matters is a blog that covers a lot of. There are a lot of different things that happen, and it comes out of Arizona actually. And I was asked to write the hearing in kids section of the blog. And I do it, I try to do it every other week. I'm not always able to get that done, but that's what I do. And it's hearinghealthmatters.com, hearing in kids.
Okay.
And and I talk about all kinds of things that are critical for children with hearing loss. Choosing technology, dealing with therapy, what has to happen in school, it's just music, all the things that are, and it's read by parents and by clinicians, and and people are reposting it to all over the place. So
Well, it's wonderful, given your depth, breadth, and time of experience for you to share that. That's really wonderful. So, in terms of the books, what books have you written? You mentioned that too.
I've written. We just finished our third edition of Pediatric Audiology.
That's great.
1 minute, I'm taking it down from the shelf. I guess I should have been prepared for this, but
No, that's okay.
here is the third edition. Carol Flexer and I did the first two editions, and since we were growing up, we decided to get some younger people in with us to continue the book in the future. And so Jace Wolf and Erin Schaefer joined us. And this is the third edition of Pediatric Audiology. It comes with a DVD that shows how to test children.
That's wonderful.
So it's got behavioral testing, behavioral observation for babies birth to 3 to 6 months, visual reinforcement for 6 to 36 months, and conditioned play from starting at about 30 months. Or with some of our kids with hearing loss, it starts much earlier because they're really trained to listen. We also have a casebook, the Pediatric Audiology Casebook. And I am just finishing a new textbook called From Listening to Language, Developing Auditory Skills for Children with Hearing Loss. And it also has some adult stuff in it. I co-edited this with Joan Hewitt. We have a fabulous group of chapter authors, and it should be coming out, I hope, in the fall. It went to the printer yesterday.
Well, that's great. It sounds like you're really idle during your retirement.
I am idle. My granddaughter, right after I retired, I was running around, and one of my granddaughters said to me, "I don't understand why this is called retirement." And
I think maybe it should do what you want to do no matter what each day as compared to doing what other people.
That's exactly correct. And this afternoon, after I'm talking with you, we're going to our house at the beach.
Oh, great.
That's what I wanted.
That's great.
Oh.
So I ask all the guests, tell me what your favorite sound is.
I have a lot of sounds that I like. I play the guitar, I play the piano, I listen to music constantly. I'm a folk music person. I was a folk music person as a kid. And so I started taking music lessons when I was quite young. And I just listen to music all the time. And so music, all classical music, folk music, Pete Seeger, Arlo Guthrie, Bob Dylan, Joan Baez.
Good stuff.
All those guys.
Well, this is great. This is Dr. Jane Madell. She is the Director of Pediatric Audiology Consulting. Dr. Madell, if people wanted to get a hold of you, how would they do that?
Well, if you go to my website, you will get my email, but my email is jane@janemadell.com. JANEMADELL.
So you have a website, www.janemadell.com.
Exactly. So www.janemadell.com.
Right, everybody should have a website, right?
Well, my husband made it for me, but I decided to retire. Somebody said to me, I think you need a website. And
it's a great URL, right? It's a great web address.
It is. You can't have any trouble figuring it out.
No. And you know who it's about, right?
Yes, and what it's about.
Right. This has been a great conversation. I appreciate so much you coming on onto the podcast again. If people want to reach out to her, it's janemadell.com, and it's jane@janemadell.com. She has a wealth of experience and consults for people, families with children with hearing loss. And I really appreciate you sharing your wonderful experience and knowledge. And what really comes through, frankly, is your passion about this topic. This has been wonderful.
Thank you.
Thank you so much for coming on.
Sure. I'm happy to be here. Bye-bye.
Thanks for tuning in to the Listen Up podcast. We'll see you again next time, and be sure to click subscribe to get updates on future episodes.